In this video, I want to talk to you about Sever's disease. What actually is Sever's disease? Who does it affect? What causes it? And two of the important things that might be told to do that you must not do in order to get the correct long-term solution for Sever's disease. So let's go. Thanks for checking out the channel. My name's John, head therapist here at John W Sports Injury. We want to be doing three simple things. Help you understand your body so you can get rid of pain in order to return to your sport, health and wellness goals. If you haven't subscribed yet, well, if this is the type of content you want to be seeing as you make your way through this video, hit that subscribe button and the like bell, and we will be making sure we keep you updated on all of our content. But let's dive into this topic, Sever's disease. Now, I always think Sever's disease sounds a little bit more dramatic than it actually is. But firstly, what is the condition? Well, typically it presents itself as a condition that affects growing children. So perhaps between the ages of about 8 to 13 or so in our clinical experience, but it can certainly be higher than that as well. And it manifests itself with pain in and around the heel area. So why is this happening? Well, this happens because this area in the growing child isn't actually turned to bone yet. It's a growth plate. It has what we call ossified, so it's a sort of soft cartilage area. Why is this a problem? Well, it's a problem because we have these calf complex muscles, most noticeably the gastrocnemius and the soleus sitting a little bit deeper here. Those muscles attach to that area via your Achilles tendon. So in this growth plate, there so that the bones can be growing, is still soft. If we use these muscles a lot and the Achilles tendon creates a lot of force on that area, it can create some soreness in this area. And that's how it typically presents itself. Pain perhaps that isn't there at the start of sport and exercise, but then develops as sport and exercise goes on. We may see children having to walk on their tiptoes to stop putting their heel down, or just getting that real soreness in the area. It's a very common condition. But firstly, what I want to do is tell you the two things you must not do that often get told to do. And they are, the two schools of thought around this might be, well, it's growing pains, just play through it, it will go. And the second thing is you need to stop everything that you're doing until the pain goes away. I want to explain why both of those things I think are wrong. Firstly, if you just play through it, it's an overused condition. The pain is only going to get worse and it's going to intensify, and you're not getting to the correct cause in order to remove that. Secondly, if you just rest it, yes, the symptoms will settle down. But again, what we haven't done is got to the cause. So it's like trying to fix a leak by just plugging that area. We know that ultimately we need to find the true cause, because once we go back into the sport and exercise, if we haven't corrected it, what's going to happen? The pain's going to return. So actually what you need to be doing is finding the cause and then correctly rehabilitating that area. And that's what we're going to talk about now. But before we dive into that, I do want to say that Sever's disease is a condition that if you suspect that that may be happening, I would always get that checked out by a professional who works with the condition closely, so you can get an individualized, personalized rehabilitation program. Because when we're dealing with these conditions that relate to nature and puberty and all those types of things, all of the children are different, and there isn't really a one-size-fits-all approach. It's important that you're finding out the correct cause and program for your child. But what I wanted to do is really just dive into some of the fundamentals here, things that you can be getting to work on in order to help. So firstly, if we know that too much force is being applied here, we want to see the sort of flexibility of this area. Is this area tight? And actually that's causing that force into the area. How do we do this? Well, we can do something like a knee to wall test. So for this, you just want to come up against a wall and you want to place the foot, firstly, of the uninjured side. If there is an uninjured side, this condition certainly can affect both sides, but you want to take that a certain distance away from the wall. Now, the test really is, can we take the knee so that it touches the wall without having to lift the heel? You can see I can do that quite comfortably on that side, and then we look to just work a little bit further back from the wall. Now, what you're looking to do, I can feel that I'm getting a bit closer to my maximum there. You'll hit a point as you move back where it's not able to make the wall without lifting the heel. So I think I'm about hitting that point. That's probably definitely going to be my maximum. So if I again slide back a little bit, I now can't get there without lifting the heel. So we now establish that that's our maximum. Now, this distance from the wall, we're looking for that to be about 8 to 10 centimeters. But importantly, what you now want to do is compare that to the injured side. So if we then change around sides, and I bring into that same distance, you will see now that I actually can't make that wall. My heel has to come up for that to happen. So that tells me that I'm tight in that area. I have a reduced amount of what we call ankle dorsiflexion, and therefore that might predispose me to putting more force through that problematic area. So how do we correct that? Well, this is where we may kick off with some stretching program. And I mentioned that we have two main muscles in here, the gastrocnemius and the soleus. So what we want to be doing is stretching out both of those. So firstly, our gastrocnemius, we want to be making sure that our heels are flat on the floor and that back leg is straight. We want to be holding that stretch for at least 30 seconds. We can then repeat a similar stretch for the soleus muscle. Again, we want to be making sure that those heels are flat on the floor. That's an important point. And that back leg is bent. We're again holding this for 30 seconds. Now, if stretching is causing pain, we don't want to be creating pain, just ease back on that stretching. And the other thing is that stretching can be done once, twice a day and can be repeated daily. So over time, hopefully that's going to improve the flexibility, create less force on that problematic heel, and therefore that's going to be helping the condition of severs. The second thing that we want to be doing is managing some of the pain. You know, it is a sore condition. It's okay to look to manage some of those symptoms. We can do that in a few ways. So firstly, we can use something like ice. Ice will have a double effect in this case. By applying ice into that sore area for about 5 to 10 minutes, it's firstly going to have a painkilling effect, but it's also going to look to reduce some of that inflammation in and around this attachment point of these muscles here, which again will be helping to settle the pain. We can also look to use some of our self-massage devices. So things like a massage gun if you have it, or even one of my favourite bits of kit, something like a lacrosse ball, can work really nicely. So what we're looking to do here is perhaps apply the massage gun into this area of the gastrocnemius and the soleus, working through these areas again for about 5 minutes. This is something that I would only recommend doing every other day. Give yourself or your child a day off in between to allow these muscles to settle. If you haven't got a massage gun, but you have some sort of dense ball, hockey ball, cricket ball, anything like that, what your child can look to do is to place the ball underneath the leg, and start to look to just roll through that area, looking for any sore points. If they find a sore point, they can just hold on that sore point while we look to desensitize it. What you can use is a technique that I call the pin and stretch, or we call the pin and stretch technique, which is if you find a sore point, hold on it and then look just to stretch that muscle by just pulling the toes up towards the area, towards your knee, and relax, and then do the same thing again. And that will help to desensitize this area, increase the flexibility, and put less force on that heel. So there's some of the things that we look to do right away to embark upon a stretching program, a self-massage program, and also an anti-inflammatory means using something like ice. But then what we want to be doing is also introducing a strength program. And this is something that we tend to do in a layered approach, really being geared at the stage that a person might be suffering with and making it appropriate. The first thing that we would look to kick off with is some non-weight bearing exercises. So this is exercises that can be done sat, laying down. But what we're looking to do is to actually start to encourage some movement in the area of those muscles so that they can be making their way back to sport and exercise. So the first exercise we might look to do is just in a lying position, looking to bring the toe up and relax it off. Bring the toe up and relax it off. So what I'm getting here is a contraction, a stretch, and tension through the heel, but without putting my body weight through the area. We can then do the same exercise, perhaps laying on our front, bringing our heels up, and just looking to bring down, bring up, getting that range of motion through my ankles as I work through. Nice and easy as we work through that area. If all of that feels okay and you can be doing that every other day, 12 to 15 reps, 3 sets, and we can get to the point where that is completely pain-free, then we can start to load the area again. Now, typically, there are many ways that we might like to do this, but for the purposes of this video, keeping it nice and simple, we might take an exercise like the calf raise. We would begin by doing a 2-legged calf raise. And what we're looking to do here is to go through about 3 sets of 12 repetitions. We're looking to go up and then slowly go back down. Once we get to the point where that's feeling comfortable and we're able to load that a little bit further, we can really start to test the problematic side. The way we would do this is by doing a single leg calf raise. So it's the same exercise where we're going up and going slowly back down, but this time just using one leg. And really, we want to be here comparing the good side to the bad side. Do they feel exactly the same on both sides? Then we know that we're making our way back towards repairing the condition properly. When we're doing single leg exercises, I would be looking to do 6 repetitions on each side for 3 sets. So once you've done the good leg and the bad leg, you make up your 12 repetitions or 3 sets of 12. So that's some of our key points, things that we really want to be making sure that we are addressing when we're looking at Sever's disease. But the final thing that I wanted to talk about is making sure that we are actually looking to give the condition the respect that it deserves. This is one of the things that I find with growing pains, and I mentioned some of the 2 schools of thought that I disagree with. They really don't give the condition the respect it deserves. Now, what I mean by this is we have to accept that this is an overuse condition. It's come about because we've been doing something slightly wrong over an extended period of time with a lot of volume. So what we need to do is actually take out as much of that volume as possible initially and then slowly start to drop it back in. What do I mean by this? Well, if we think of somebody suffering with a food allergy that's causing a bad reaction, what we might look to do is take away all the food first to let the symptoms settle and then slowly look to drop back in those foods while we work out perhaps what's the right balance for that person. And this is my approach when we're looking to get rid of these growing pains. So it might be that in the first instance, we need to take a week to 2 away from sport and exercise while we let those things settle. But as I mentioned, I don't then just want to go straight back into a return to that volume. What's important is that we're finding then a progressive return. So you want to be prioritizing the sessions that your child's doing and firstly beginning with a dramatically reduced amount of volume and then slowly building that volume back up over several weeks so the body can have the chance to adapt to these changes and the rehabilitation means that we're putting in place and that it's not too much volume too quickly causing a bad reaction. I hope that information makes sense. I've tried to keep this video as condensed as I can because this can be a very complex area. I want to reiterate, if you are suspecting Sever's disease, I really would get that checked out nice and quickly, just so you can get the correct program in place and not waste any more time. But I hope these tips have been helpful. Remember, establish the amount of movement at the ankle. We want to restore full range of motion at the ankle as quickly as possible. Settle the pain using things like ice, self-massage techniques, and then slowly factor in a strength building program with non-weight bearing, 2-leg weight bearing, going into 1-leg weight bearing, and then really making sure that we've got an appropriate sport and exercise return type exercise program in place so that your child can get back to doing exactly what they love to do. Have you made it this far in the video and found it helpful? If so, thank you for sticking with us. Make sure you hit that like button that shows me that you stayed all the way through and it will show others some of the content of this video. And as I mentioned at the start, if you haven't subscribed but you're liking this type of stuff, make sure you hit that subscribe button, hit the bell notification, and I will see you on the next video.